So come on, then tell us about bunions. What are they and why do we get them?
Okay, why do we get them? Okay, so there's loads and loads of sort of differing information out there about bunions, the causes of bunions, and how we can prevent them. There's a lot of misinformation out there, as quite often is the way with the internet. There's also a lot of confusion amongst the professionals as to what causes bunions. Again, that's not uncommon with any of our sort of areas that we work in, with any particular injury. But we do know one thing. We know there's a sort of 2 to 4% incidence in the general population. We know that, unfortunately, women are 90% of that population, and it's a real problem in the female population. We know that it generally comes around in sort of 30 to 50-year age bracket, although there is a high incidence in the juvenile population, so there is quite a high incidence. There is, yeah. But we tend to see the results of that early deformity in the sort of muscular skeletal maturity when they sort of hit 18 to 21 years old. We start to see more of the results as they get a bit older. And certainly the painful aspect, which is what most people will present at the clinic with, that doesn't tend to present until they're a little bit older.
Okay.
That's not 100% true with a lot of the juvenile Hallucis Abductor Hallucis, which is a technical term for it. But then there's quite often underlying inflammatory conditions, sort of juvenile arthritis, etc.
Okay, so is it true that shoes can cause it?
Absolutely, yeah. The footwear does have a large implication, and now my screen's come back on. I'm just going to pull up a little picture, and it's not that one I want. Now, shoes.
Just not the holiday pics, Glenn.
Okay.
There we go.
That's it. You don't want to see my holiday pictures. So as you can see here, it's a classic sort of picture, and probably the most common finger that's pointed at footwear is the high-heeled sort of footwear.
Okay.
With very tight, narrow toe box. And what that does is, as we can see here, it causes a change in the direction of the big toe. And essentially what it does, can you see my foot there, Maria?
Yeah.
What it does is it squeezes the toes like so. And a bunion basically is a deviation of the toe at this point here. And that goes laterally. Okay. And then there's a medial deviation of this metatarsal bone here. Okay. So you've got them acting in 2 different directions. So you can see how the shoe here is causing that squeeze and starting the first of the problems there. I'm just going to take you on to another picture, which is that one there. So as you can see here, we've got that lateral deviation of the big toe.
Okay.
Can you see that okay?
It's not quite clear, that one.
Is that not quite clear? Let me find a better one then. Let's go for that one.
Yeah, that's better.
That's better, okay. So we've got that lateral deviation. It's going away from the centre line of the body of the big toe itself. And then the metatarsal bone, which is this bone here, goes medially. And then you get that classic sort of outcropping here of that medial aspect of the bone. And that's the bit that causes most of the pain. And that's what rubs on your shoes, and that's what is really the fundamental part of the pain process in this picture.
So
now,
sorry, go on.
Sorry, a lot of research would suggest that there's extra bone growth around here.
Okay, yeah.
Now, the verdict's a little bit out on that. There's some papers say that there is extra bone growth, some papers say there isn't. But certainly this sticking out to the side does cause trauma to that bone there, particularly from footwear. But there is sometimes a little bit of extra bone growth around that area there, according to some of the papers.
And I guess it's like with all things. I mean, I've seen loads of bunions as well, and they all look slightly different. So it's safe to say that some people may have it and others won't necessarily.
Absolutely, yeah. I mean, there's different staging of bunions, which I won't go into in too much detail, but basically, the more deviation you have with the big toe, the higher the grade of the bunion.
Okay. Yeah.
And the problem with that is not only does it affect the big toe, or what we call the first ray, which is your big toe all the way down to the midfoot here. As it starts to deviate and encroach on the other toes, these then start to retract and claw, and then you get problems with the backs of the toes rubbing on footwear, and also it changes the mechanics of the feet quite considerably. And the resulting change in mechanics then loads extra weight through the lesser toes over the metatarsal heads here, which is the knuckly bit. So if you picture a hand up breaker, the knuckly bits under there would represent the metatarsal phalangeal joint here.
Okay, cool.
Now, if you look at the big toe, you can see it's got a lovely big surface area here. It's nice and wide, it's designed to take load. If we look at these little chaps, you can see they're probably a half or even a third of the size of the surface area of the hallux there. And so, therefore, you start to get hard skin build up underneath that area of the forefoot. And that brings a lot of people to the clinic because of that pain, particularly in that area there. And that essentially happens is because as we come up and over, we then start to twist, either because it's painful to load through that toe, or because that toe doesn't work quite as effectively as it once did, so it doesn't bend quite as well. Again, the research is kind of differing in that. Some people say it bends absolutely fine, other people say it doesn't. But certainly there is a trend where people then twist off as opposed to coming off nice and squarely like so. You also get a lot of people reporting pain over the medial aspect of the bunion here. And in some cases, you also get sort of a neuritis, an irritation of the nerves. It passes over the back of the joint here. And that can be quite uncomfortable as well, giving you like a burning sensation down into the big toe. I'm just going to pull up my...
So my mum's been preaching at me since forever, the first moment that I can remember, about shoes. Not to wear narrow shoes, and I mean, I was given the biggest feet ever on a female, so I can't fit my feet into normal female shoes. So I've always worn trainers or wide shoes, but I'm definitely starting to get bunions. So what would be the cause for that? Or what could a possible cause be?
Most bunions are hereditary.
Ah, thanks, Mum.
So footwear does play a part. I mean, there's other causes. A long big toe is another cause. Tight hamstrings and tight gastrix and soleus, or tight Achilles tendon, has been cited as a cause. Again, the research doesn't necessarily agree with that. Neurodynamic changes, so changes in the way that the muscles are firing underneath the toes. Increased big toe sort of movement, so increased first ray mobility, so hypermobile feet is another instance of it. There's certainly many different ways. Even amputation of the second toe or a short second toe can lead to bunion formation as well. Most of it is hereditary. If your mum or dad has bunions, it tends to go down the female side, but if your mum or dad has bunions, then there's a good chance that you could inherit that. And they tend to be bilateral as well, just to compound the misery.
I think I'm probably going to fall into the hypermobile feet then. That's going to be the case for mine.
Yeah.
Okay, so if you're saying they're hereditary, which I can't say that word, is there anything we can do about them?
Okay, so the only way to get rid of a bunion effectively is surgery.
Oh no.
That is the only way to get rid of a bunion.
Okay.
Now, in the half an hour slot that we've got, I could use 3 of those slots just talking about surgery, so we won't delve into that in too much detail. Only to say that Paula Radcliffe suffered with bunions for a very, very long time. She changed her running gait to offload the painful bunion. So she changed her whole way of running to accommodate that pain.
Yeah.
And then after she ended her career, she had the bunion surgery. And she said, this was a quote from an article she did for the Daily Mail. She said that she wished she'd had it done years ago.
Oh, wow. Okay.
And she still runs. Obviously not to the same level, but she still runs to a degree.
Okay.
Now, I think possibly I would err on the side of caution with any surgery, and I'd always try and exhaust the conservative methods first. The conservative methods are really only aimed at pain reduction or cessation. They are not going to improve the position of that toe. There's many, many different ways conservatively of addressing that. So I'm just going to take you through a couple of the sort of common ones. And again, my iPad has decided to give up. I'm going to take you out of this program. So I think you asked me about toe splints.
Yes, that was one of the questions that came in. I remember I bought some years ago, but yeah.
Did it work?
Well, they're a little bit of a passion killer to wear them at night in bed, isn't it? So yeah. It's really weird to sleep with your toes straight.
Yeah, absolutely. Yeah, and it irritates the tips of your toes and the bedclothes as well. Or if you're laying in front, digging into the mattress. So they're not the most comfortable thing, as you well know, and they are a little bit of a passion killer. This is kind of the classic traditional one that you'll see out there. There are so many different types out there. This one here is a little bit more of the RoboCop version, a little bit more expensive. But all of them are aimed at restoring the position of that toe.
You know what, Glenn,
can you see that or not?
Can you show it on your iPad to us maybe? Because I think the angle of the screen or something's just doing a white thing. No, somehow it's just showing up as a white screen.
Ah, okay. It's not a very interesting slide, to be honest, but it's just to give people an idea.
Yeah, you know what? I'll post a picture of the splints afterwards in the comments thing, because I can't think
Yeah, perfect.
Yeah.
That'd be great. I'll forward those on to you. Can you see those ones, Marika?
No, can't see any of them. I don't know what's going on with the screen.
Can't see any of them. All right, well, scrap that screen then, because that is not working. I think it's because it's too white on a white background.
Yeah.
But so you can get silicone wedges that go in between the toes.
Okay.
And again, they're aiming to straighten the toe out. And that can reduce the kind of stretch forces on the joint capsule, which is predominantly what causes a lot of the pain.
So those splints, sorry, just to take you a step back, do they actually work then?
They help reduce pain, but they don't give you any lasting effect of straightening the toes.
Okay. And would you, if somebody was in a lot of pain, would they wear them just at rest, or would they wear them during the day as well?
Some people wear them during the day as well.
Okay.
A lot of runners actually use a taping technique along the inside of the arch and the big toe that again pulls the big toe back into alignment.
Okay.
And they report that quite an effective way of reducing symptoms. I think what I'll do, Marika, I'll just go through the anatomy that we're dealing with to give you an idea of why this stuff doesn't really work.
Yeah.
Okay, so can you see that all right? Is
that
working?
Yeah.
Okay, so this is underneath the foot. I'm just going to take the first layer away. So this white structure here, this is your classic sort of plantar fascia. Okay. So large structure, I would liken it to a cross between an elastic band and a spring. Very powerful. Okay. Let's take that away. We're then going to look at this little muscle here. Okay, and this is Flexor Hallucis Brevis. Okay, so Hallucis is the flash term for the big toe. Okay. So this is the muscle, the short muscle that flexes the big toe downwards. Okay. Again, very powerful muscle.
Yeah.
And takes a lot of force to alter its sort of mode of action and its trajectory when it's pulling. Okay. The big one with the big toe is this chap here. So I'm just going to mark him up. And he plays a huge role in the formation of a bunion. So this is the Flexor Hallucis, so extensor, sorry, Hallucis. Pulls the toe upwards, so it pulls the big toe up in the air like that.
So if I had to show where that is on my own foot, then that kind of runs along the front, this bit, isn't it?
That's right, yeah. So it runs, if this is your foot here, hang on, let me get my dodgy feet out.
Did you paint your toenails?
If this was your foot, you can probably, you can probably see my extensor hallucis sticking up.
Okay, yeah.
And that comes all the way up my foot and across my leg there. Can you see that?
Yes, yes.
All right. Now, all the time it's pulling in a nice square fashion down here, it's going to be locking this joint into position.
Okay.
However, as the toe deviates around the corner, as you can see, it inserts into the tip of the toe up here.
Yes.
Okay. As this deviates around the corner, it then acts like a bowstring and starts to pull this around the corner.
Yeah. It's definitely doing that.
And that's a huge muscle. Very, very strong muscle. Okay. Very long length of muscle as well. So trying to counteract that is very, very difficult.
Okay.
We'll then bring you on to this little chap here. And again, it will show you just how much force you're acting against to try and correct this problem. So this is Abductor Hallucis. So this pulls your big toe in towards the midline of your body.
Yeah.
Okay. In the sort of pathomechanics, the reason that this problem is caused, this has a large part in pulling this out of alignment in combination with displacement of these little bones here called sesamoids. So these two little bones that sit underneath the big toe, they sit in one of the very small muscles. They all get pulled out of position, and once they're pulled out of position, they then start to act in a manner that contributes to further deformity of that toe.
Okay.
Trying to counter that is very, very difficult. You've got
yeah.
huge strength that you're working up against, and you're using muscles that are now in a slightly mechanically disadvantaged position, so to try and counteract it. So other sort of papers, and a lot of people advocate toe strengthening and stuff like that. And that's true, that it can help, certainly help with pain, but will it give you absolute correction of the toe? Very, very unlikely, if at all, if not perfect. I've never seen it work, but it does work brilliantly for pain on the joint capsule. So that medial pain, that nasty, irritating pain that really brings.
So interesting. I wonder if in people who don't get bunions, is it that their ligaments are keeping that toe in the perfect alignment? And do you think it's in the rest of us, maybe the ligaments fail? Because if the muscles,
of different factors on that one. So there's if we go down right down to the osseous level, right down to the bones, the shape of the phalanx here, shape of the head of the metatarsal head here, that can have an effect. So this can be different in shape. So it can be quite a peaked sort of joint here, which leads to more joint instability. There's loads of different variations that the sesamoids can change position, and you can have a medially deviated sesamoid as a result of congenital sort of problems. If we go to skeletal level, you could have a neurodeficit where one of the muscles is working quite nicely on one side, and on the contralateral side it isn't working as well, so then you get that deviation occurring. Footwear, there's so many different factors, both intrinsic and extrinsic, that the sort of approach to this has to be multifactorial to try and improve the position. The only way to truly correct the bunion is through surgery.
What would they do when they go and do surgery? Do they fix the toes together or the bones together, or what would they do normally?
Again, that's a really long-winded sort of explanation, because there's about 10 ways of skinning that particular cat.
Okay.
But effectively, depending on which one they do, they'll cut this bone in half through its longitudinal section here,
Okay.
and they'll slide the bone back into position and lop off the extra bit of bone that's no longer required, and then screw it together.
Please don't explain
really
that to me like that before I have surgery. Okay.
I mean, it is effective. I mean, there's about a 15% recurrence rate of the deformity.
Okay, yes.
So it's not a complete answer.
Yeah.
It's not a complete answer. It's bloody painful.
Okay.
And you're going to be laid off from running for a while,
Yeah.
It's a bit like knee replacements, Marika. They either go really well or they're a problematic sort of picture post-surgery.
Yeah.
And
I guess our advice would be the same as with a knee replacement, that you wait until you really can't bear the discomfort in the foot anymore before you really think about that.
So what we haven't covered yet, and I'll sort of leave it to a bit further into the conversation, is the role that pronation or flat feet has in the formation of bunions. Now, it's a simple answer to that. It doesn't have any effect on the formation of bunions.
Okay, yeah. See, so that's counterintuitive for me, because I would feel as if the foot does that more often, then it's going to cause it to turn that way.
Exactly, that's what we used to think. But the research shows us actually that's not the case. And in fact, the pronation tends to come after the bunion has formed.
Ah, okay. Because the big toe's not there to keep it all nice and stable then.
You got it. Yeah, you got it. And then because of that sudden pronation that occurs, now I'm going to say as well, pronation gets a bad rap. We need pronation, okay? So it's often the villain of the piece, but it's really not. And we do need pronation, but in this particular instance, pronation at the timing of the pronation towards the late part of as we come through the contact phase of the gait cycle, that can really cause a stretch in the joint capsule, and that's where, particularly when you're running, when you've got greater forces acting in a shorter time span, because you've got much less time on the ground, that can really cause discomfort and pain.
Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.